And earlier in the hour, we told you one of the heartbreaking stories from the New York Times piece entitled, "They Spurned the Vaccine. Now they want you to know they regret it." Reading more now from that report, quote, "Some people who were quick to embrace the vaccines are now choosing to speak out about family members who did not." It was a role Kimberly Jones never wanted, but one she embraced after her daughter, Erica Thompson, 37, a mother from St. Louis, died on July 4th, nearly 3 months after she had what she thought was a bad asthma attack. "I want to be a voice for her," said Miss Jones, who got vaccinated as soon as she was able to. "I really think my daughter would want me to say, go get vaccinated." Her mother said Ms. Thompson had been leery of how quickly the Moderna and Pfizer-BioNTech vaccines had rolled out, the culmination of decades of scientific research. She also believed that the government-run campaign was a plot against Black people like her, according to her mother. Let's bring in the reporter behind that New York Times piece, national correspondent Jack Healy, also with us, staff writer for the Los Angeles Times, Brittany Mejia. She's covering the reasons why it's taken some people so long to get vaccinated. But Jack, back to that case of that mom. Where was her daughter getting her information?
Like a lot of people, she was getting information from social media. And there has obviously been just a welter of disinformation and misinformation circulating that has encouraged people's hesitations. It has led to people having all of their doubts reinforced. And in this case, there was nothing her mom could do to convince her to get the vaccine, even though her mom got it. And basically, in this case, her daughter said, I'm just not certain. And her mom tried to tell her, nothing in this life is really certain, but this is the best we've got. But ultimately, she didn't listen. She didn't get the vaccine, and she ended up in the hospital. And it was really heartbreaking because what Kimberly told me was that her daughter didn't want to be sedated, didn't want to go on a ventilator. And the day that they finally had to do it, her mom said, "I'll be there when you wake up," and sang to her as they sedated her and put her under. And of course, she never really woke up until her last moments, when they finally took her off the vent in early July and she passed away. And what Kimberly told me, her daughter's last words were, "Mama, I can't breathe." And it's just these stories are just absolutely heartbreaking. And the reason I wrote this piece is that families are trying to speak out to say, basically, don't be like us. Don't go through this. Don't go through this journey that we've been forced to go through.
And every time the answer is the same in terms of where the bad information came from. It's from social media, from places like Facebook, which are carrying tons of bad information every day. Jack, reading more from your piece, quote, "In Springfield, Missouri, where coronavirus cases spiked this summer, Russell Taylor sat in a hospital gown, an oxygen cannula draped across his face, to offer a pro-vaccine testimonial in a hospital video. 'I don't see how I could not get it now,' he said." And Jack also described one woman's hesitancy to speak out in fear of COVID deniers. Quote, "In a shaking voice, a hospital clinic administrator in rural Utah described how she had been pummeled by double pneumonia and sepsis after choosing not to get vaccinated. The woman, Stormy, said it had taken weeks to summon the nerve to speak out in a video posted by her local health department. She did so using only her first name because she worried that COVID deniers would say she was making it all up. I was absolutely fearful of the negative aspects that could come from it," she said in an interview this week. "I was part of a problem that I was trying to avoid." And so, Brittany, to your piece, which is entitled, "Why Haven't You Been Vaccinated with COVID-19 Raging? People Explain What Took So Long." What took so long?
Yeah, I feel like my biggest takeaway from going to this pop-up clinic in a mostly Latino community is that the unvaccinated are not a monolith. There's just so many varying reasons. And a lot of what I was hearing were actually Latinos who had already gotten COVID. And so in their mind, they were like, I don't understand if I do need to get it again. Do I have immunity? So that was one that kept popping up. Along with that, I had other people who didn't have time to take off of work and who happened to give up their lunch hour that Friday to get vaccinated. So there was a desire to get the vaccine. It was just about access and convenience. And I think that's something we have to consider. It's easy. And what we've been hearing more lately is people getting called selfish for being unvaccinated, but there's varying reasons for why that is. And it's easier to call someone selfish than do the work to try and understand why this is happening.
Auxiliadora Gutierrez held off getting vaccinated over the last few months to see how other people reacted to it. Gutierrez said she had recently watched a man on Spanish-language TV talk about how he had waited and finally decided to get vaccinated, but got sick before he could get his shot. He said, "Vaccinate yourselves. Don't keep thinking about it," Gutierrez said. That motivated me. I didn't want to keep thinking about it. And you also write about Marco Figueroa, who had completed 5 deliveries for work when he saw the sign that he'd been waiting for. Vaccuna do COVID gratis, free COVID vaccines. His sister and brother got vaccinated in May, but the 42-year-old wanted to avoid taking a day off from work. Luego, he would tell his siblings when he asked when he'd go. Later. When he spotted the poster board affixed to a utility pole, he decided to give up his lunch hour to get vaccinated. His co-worker parked their work truck in a loading zone on 12th Street and waited as Figueroa headed to the blue tents where 2 registered nurses were giving vaccines. As he waited the 10 minutes for workers to prep the Pfizer vaccine, he gripped the sides of the black folding chair where he sat, not because he was scared, he said, but because he was worried about falling behind on the deliveries he had left. So, Brittany, I guess the issue is, as much as possible, this vaccine needs to be made available. I know the Biden administration was committed to trying to make vaccines available within 5 miles of most Americans, but it's still hard for those living paycheck to paycheck to get the time to do it.
Yeah, definitely. That is exactly what's happening. It was interesting. After this piece ran also, the Craig Taubman, who actually heads this nonprofit, he told me that after hearing the Marco story, he was inspired to actually, do this at Home Depot. And I think the big push is bringing the vaccine to the people and having conversations about this very thing. I mean, I was hearing from people telling me that they heard misinformation in their own homes. And I thought Jack's piece was so great because it really touched on all of that and shared these stories, which really do make a difference. I think when people hear about others who waited and got the Delta variant and got sick, it's a motivating factor. That was a big push for a lot of people also who came to the clinic that day to get vaccinated.
Hey, Jack, your piece was very powerful, and we're hearing more of these stories, it seems like, in recent days of people who it's too late for them to get that vaccine, people who are seriously ill, perhaps dying, but encouraging others, or at least their families, or telling others, hey, don't be like us, encouraging others to get those shots. That's the thesis behind what they're doing. We are seeing a rise in cases, but also a rise in vaccinations in some of the states that are being hardest hit. Is your sense, are these personal appeals working? The people that you've talked to, do you have a sense whether they're friends, relatives, cousins, coworkers, neighbors, whoever it might be, are they seeing these stories of suffering and deciding, okay, now I will get the shot?
Some of the people who are closest to the families that I've been talking to, it absolutely made a difference for them. A cousin or a neighbor who watched some of these families go through what they've gone through. But and I think what was so great about Brittany's story is also that it really kind of, all this encompasses like what a house-to-house, family-to-family battle this is at this point. Like it's just convincing people by people and the amount of effort that it takes, to break through this hesitancy or the lack of access. I talked to some public health experts who really were skeptical, though, about whether even stories of like incredible suffering and even deaths from people who had gone through this would penetrate the layers of determination and misinformation and just resistance that have really hardened over these last months with a large segment of the population. And if a story of watching someone who used to be vaccine resistant, having their loved ones fall sick or die, if that doesn't break through, then what's it going to be? So, and that was a real tough question for some of these public health experts.
The New York Times' Jack Healy and the LA Times' Brittany Mejia, thank you both for your reporting this morning. And up next, most Americans are dining out again, and restaurants are welcoming the return of customers. But with the good comes the bad. We'll explain that next.